good afternoon. We're going to be talking about not coronavirus, but concussion. And Mike and I are not practicing appropriate social distancing. We're going to be standing next to each other so we're in the same frame. So our video last week with Katie, she was talking about our upcoming partnership with Complete Concussion Management. Mike is also going through the training program, and so today's video we're going to be talking about concussion symptoms. So got my list. So what kind of symptoms in general might happen with a concussion?
So generally we link the concussion symptoms or group them into 4 different categories. The first of which is being issues with your thinking or your remembering. So oftentimes people report having issues concentrating on things or making new memories or remembering things that they've recently been told, things like that. They can also have more physical symptoms, which would include things like being nauseous or vomiting, or visual issues or issues with stimulus with light or sound, or even sometimes neck pain. The other category would include emotional issues, such as being a little bit more irritable, a little bit more anxious, maybe sad, things like that. And the final thing would be issues with your sleep. So that would include having a harder time falling asleep, having a hard time staying asleep for the normal amount of time, or sleeping more than you would normally sleep.
Mm-hmm. So I think that's a lot of different types of symptoms than people kind of assume would be from a concussion.
Right. You can have just one of those symptoms and just have one of them, and that would still fit into you having a potential concussion. It's a little broader than people are aware of.
Yeah. What kinds of symptoms would really be a sign you need to go to the emergency department?
So one of the classic symptoms would be a severe headache that is unrelenting, that won't dissipate, and it might even be getting worse. So that would be a sign of something that's a little bit more significant with your vascular system that would need to be looked at closely. Also, if you had the nausea and vomiting, that can happen early on, which is something I didn't mention before, but if you have nausea and vomiting that persists and gets also more significant, that would be definitely something you would want to have checked out. There's other things like issues being awoken from your sleep. So if you're sleeping and someone can't wake you up, that would be a potential cognitive thing that you would want to look out for. If it's a younger child that has had a concussion, if they are crying more than usual and you can't stop them from crying, you would want them, that would be a reason if they've had a recent injury to take them to the doctor.
Mm-hmm. Okay. And so you're talking about persisting. How long would these symptoms normally or on average last after the injury?
So there's 2 things to consider. Sometimes people will have these symptoms right away, but oftentimes it can take hours, even days, for these symptoms to present. So if you've had a head injury and you don't notice the symptoms until a few days later, that can actually be fairly normal, because as you start to try and regain your normal functional status and do your normal things, that's when you will start to notice that something's not right. So that wouldn't be a reason to have too much alarm, but you still want to potentially seek medical attention. It just might not be urgent. And then these symptoms can last for days to weeks to months, even afterwards. But a symptom like a severe headache is something that should not last more than a day or so, even hours or less.
Mm-hmm.
The nausea, vomiting is also one that should go away within a couple days.
Okay, yeah, so pretty short.
Short, yeah.
So we've been talking a little bit about testing in our previous video, and we'll talk more about that in some upcoming videos. But in between the baseline testing and testing intervals, what are we doing to treat patients, and kind of what symptoms are we targeting?
Some of the classic things that go along with a concussion is often people will have issues with their balance, and that's something that PTs are very good at regaining, is your normal balance ability and staying on your feet. Oftentimes people have issues with how their eyes are functioning, and that can go in conjunction with the balance. And so there's a portion of our balance system called our vestibular system that PTs here, especially at Core Balance, are very comfortable treating. So that would include doing eye exercises as well as balance exercises. One of the things that has been shown with concussions is that there's a blood flow issue and there's an energy issue. So PTs can be trained in how to develop an appropriate cardiovascular conditioning and exercise program that can help stimulate blood flow back to your brain and get you back in shape and get your energy levels back up. And the final thing is neck pain, which can sometimes be related to the concussion, but can also be a secondary whiplash. And PTs are often very good at treating musculoskeletal pains, such as muscle and joint pains in the neck.
Right. The whole shebang.
The whole shebang.
All right. Well, thanks, Mike.
Yes.
Thanks for joining us.
Thank you.